Hello, my name is Ari Ramachandran and I'm from Winchester, Massachusetts. Today I'm joined by Dr. Athreya, a general practitioner from the UK. Today's interview is going to be a little bit unique because we'll be receiving a different perspective on how the pandemic is affecting another country, more specifically the United Kingdom. Dive right into the question. Dr. Athreya, can you please provide a brief introduction about yourself?
Hi there, my name is Kannan Athreya. I'm a UK-based GP. I qualified in the UK, having studied in London, and I've now been a general practitioner for the last 30 years. I worked with the NHS for the first 25 years, and then I left, and now I own my own private clinic, and I've been seeing private patients now, which is somewhat of a different thing in the UK compared to the States. But I've now been a private GP and also dabbled a little bit of aesthetics since 2014.
Okay. Now, are your consultations face-to-face or do they occur remotely?
Well, obviously, in normal circumstances, they'd all be face-to-face, occasionally telephone calls, but now we try our best to keep them as remote consultations. As you may be aware, social distancing is important. Reducing risk of COVID transmission in between individuals is also very important. Therefore, we have to minimize the risk. As far as possible, we try and do remote consultations, not only to protect patient safety, but also the healthcare worker safety as well.
Okay. Now, aside from being a general practitioner, do you also specialize in aesthetic surgery? And how does this play a role in the midst of all this COVID?
Well, a slight correction. I specialize in non-surgical aesthetics, not quite aesthetic surgery. Well, it doesn't really play a role in COVID unless you want to look particularly good for the ICU, which I don't see why not. If you're going to be ventilated, you might as well look sharp.
Okay, so how do you think the landscape is different in the UK compared to the US?
Well, obviously, I'm not so familiar with the US system, but you might be aware that in the UK we have the National Health Service. Now, I don't work in the National Health Service, I work out, although I've offered my services to the NHS. I'm still waiting for their call. They must have heard about me. Anyway, so but in the UK, the National Health Service is a universal healthcare system. It's paid for by taxation, and it's based on the principle of free at point of contact and care irrespective of a person's ability to pay. So in that sense, anybody who lives within the UK and pays their national insurance, as we call it, can attend any hospital and get good care, which should be appropriate for their needs and also accountable. And each healthcare worker that gives them the care is accountable for the work that they give them, for the service they give them. Now, in the USA, I understand it's a little bit different. I think healthcare is predominantly private. It's very much linked with the work that you do. And we're given to understand that many people go around with inadequate healthcare. So it is not something that UK would favor whatsoever. But I'm also given to understand in the US, they look at our system in a funny way as well. What do you think?
Well, I do know there is one similarity in this, which I think is common around the world, where they are saying that any patient who suspects they have COVID or is fighting COVID will get treated for free. So, yes, I suppose that is
treated for free?
For free.
Oh, that's very good.
Okay. So, what is the UK status on PPE equipment and testing, and do you think that they're prepared for their upcoming peak week?
Well, I mean, you might be aware PPE is a problem worldwide. It is a problem. It is a problem in all the countries that have COVID at this moment in time. We are very short of PPE at this stage. We are scouring different countries in order to get PPE stocks to come in. Today, we heard that Turkey are now producing 400,000 outerwear, outer garments for doctors. But 400,000 will be enough to service the NHS for 3 to 4 days. So you understand what the need is. It is immense. So now we're utilizing as many different organizations as possible who are normally involved in fashion, such as Burberry or Barber. They're now trying to make PPE for healthcare professionals. And also there's been a massive push amongst individuals with skills to produce whatever PPEs they can. A young lady today of 8 years old is now producing masks with a home printer, with a physical printer. So these are all the kind of efforts that we're doing. Whether we're going to be able to cope with the future is difficult to say. The COVID situation in the UK is plateauing, but that's mainly because of social distancing. I do remain quite concerned about the possibility of second or third waves. So we do need to ensure that we have adequate protection for healthcare workers.
Okay, now you mentioned the number 400,000. Is that so for in terms of medical kits to treat people with COVID, ventilators and stuff like that, is the UK intending on treating everybody and testing everybody, or just the people who are symptomatic?
Oh no, but obviously people who are symptomatic. I mean, let's not forget the vast majority of COVID sufferers won't go anywhere near a hospital. Quite a number of people may not even know they have it because you have asymptomatic carriers. And this is something very important for yourself and your viewers to understand. Generally speaking, what we are dealing with in hospitals, the news we are getting are the people who are getting severe symptoms. Most people will not be having severe symptoms. And this is the difficulty. And this is why we do social distancing. Because there are people out there who have the illness or who may be carriers of the illness who are asymptomatic but are still virus shedding. Yeah. And they may infect somebody who are more vulnerable of underlying health conditions who will then have a severe reaction. And this is the problem. Yeah. So obviously only the very small minority, I think it's up about, I think 80% of people have very mild symptoms, 15% have moderate symptoms, but even they will be managed at home. Only 5% will need hospital, and out of those, only 1% will actually need ICU. So this is vanishingly small, but 1% of a large number is still a large number. Yeah. And it's far more than hospitals are able to cope with than in any normal circumstances.
Sure. Now, I know you've already highlighted some differences, but are there any other differences that you'd like to highlight and how the pandemic is being handled both politically and medically between the US and the UK?
Well, I'm not quite familiar with what the US is doing at this stage. I only know what I see on Jimmy Kimmel. But as far as I understand it, the difficulty with the US is the fractured healthcare system. It doesn't seem to me there's any central organization. And you can again tell me, it seems to me that individual states are bidding for ventilators and PPEs competing with each other, which is something you will not find in the UK. So I do find this kind of capitalist market economy quite ludicrous when it comes to the fact you're all Americans. Yeah, and so I do think there should be a centralized approach towards healthcare in the US, and I sincerely hope that this particular situation has exposed the failings of the healthcare system. But in order to expose the failings, one needs to accept that something is not quite right. I'm not too sure with the pride that I see in the way the Americans feel about their country, that they will accept that something doesn't quite work well. This may be controversial, but that's the way I feel on the side of the pond.
Of course, but but how does the fact that prominent figures like the Prime Minister and the royal family having contracted the virus play a role in how the UK is dealing with the pandemic?
Right. It doesn't. Well, sorry, please finish.
Sorry?
Please finish.
Okay. And how does that impact the government's response?
Well, it shouldn't really impact the government's response in any way whatsoever. At the end of the day, yes, they're figureheads, and it highlights really how COVID is not a respecter of class, of wealth, of age, of race. It affects everybody equally. And if the Prime Minister, who was very, very unwell indeed, he was admitted to intensive care, so he was one of that 5%. One of the 1% that was admitted to intensive care. And it shows to highlight that if he can get it, any one of us can get it. So in terms of policy, it is not affected by that, but it draws home to all of us how this virus can affect anyone.
Okay. Now, the U.S. has mixed feelings about large gatherings in the year of 2020. So do you think large gatherings will not be permissible for the rest of the year in the UK?
I think there is no doubt, while there is no vaccine to be found, while this virus does not affect so far, we know that they feel that somewhere around 200 to 300,000 people have been affected with the virus in the UK. Let's say it's double that, or even 3 times. Let's say it's 1 million. Well, the UK has about 65 million people. That means 64 million not being exposed. There is no vaccine. So we are all susceptible. It's just a question of when. So on that basis, social distancing is very important. I personally cannot believe that there will be any situation over the course of this year, unless a vaccine is found or there is significant inroads made into loads of tests for every individual, that we'll be able to gather in social settings. In fact, I think culturally it marks a tremendous shift. I can't believe that some place like cinemas, I mean, that's a very case in point. You know, we've talked about people having wonderful home cinema systems. I believe that the cinemas will go out of business. What's the point when films can be released online and people can watch it at home? So this is the kind of way there's going to be a cultural shift. The answer to your question is that there should not be any social mixing within this year. And I suspect until the vaccine is found, there are going to be restrictions.
Okay. Now, the UK has extended its lockdown for at least another 3 weeks. So do you believe, I know you said prior that you don't think there should be, unless there's a vaccine, social gatherings for another more than year. But do you think that this 3 weeks is a good marking for a realistic number for the country to start small business?
Well, no, I mean, we have to face two different facts here. The first thing is, ultimate safety and health. The second thing is the economy. Now, if we don't start dealing with the economy, we can't carry on with shutdown. Britain is losing about £3 billion per day. If I have a child today, the country's debt will not be finished until that child is an old man and retires. So we're facing a very huge problem at this moment in time. So it is totally unfeasible that the country can continue not to work into the end of May. Mm-hmm. So my belief is that the likelihood is that when you consider the fact that most people that get seriously affected are the over 60s and those with pre-existing morbidity, if we are able to socially isolate them and to shield them, then the younger people, the fit people can get back to work. Yeah. Once we start introducing more universal testing, that will give another level of confidence. So my belief is that whereas it would be lovely to keep us all isolated for next 6 months, it is not something that can happen practically. The country needs to open up. The country needs to get working. And I think in 3 or 4 weeks, that would mark about 7 to 8 weeks of isolation. 7 to 8 weeks of lockdown. And we will see at that point how well the country can then cope with a return to work, but maybe under different circumstances, like a phased timing so that the public transport is not all occupied at the same time. Some may start 7 a.m., 8 a.m., 9 a.m., 10 a.m. That would make a difference. If everyone over 60 remained at home, that's a given. These kind of adjustments will, I think, allow people to get back into work and get the economy going again. So yes, I do see that by the end of May, certainly by the end of May, if not a little bit earlier, that there will be a phased return to work.
Okay. So just as clarification, you're saying regardless of whether there's a vaccine or the virus gets worse, the 3 weeks or by the end of May, the economy has to open up again and businesses have to run again, because otherwise Britain will be in such a immense
the truth is that I believe the more people will die as a result of a failing economy than they ever will out of COVID.
Okay. Now, this next question is about herd immunity. And for those who don't know, herd immunity is when a large group of people become immune to a virus, and that could either be as the result of a vaccination or just your body naturally developing antibodies for the disease. So with COVID, there is no vaccine, and people aren't getting immune from the virus even after fighting it. So can you please elaborate as to why the UK attempted to develop herd immunity without a vaccine?
Well, herd immunity is not a bad idea in the circumstance. And had it been thought out better, it may have been done a bit better. As we mentioned earlier, if we look at the at-risk groups, if we're able to isolate the at-risk groups and inform them that they're the ones that would need to be shielded themselves, it is very, very likely that the others left within the community may well be able to get back to work, again with appropriate social distancing, because it is very likely that when they get COVID, they will not be seriously affected. Now, the more of the younger people who get COVID and get more seriously affected, the more immunity they're going to develop. Now, let's put one thing aside. Nobody quite knows what immunity is going to be like here. We don't really know if it's an effective immunity. Perhaps there are more than one strain of coronavirus. If you get one coronavirus, you're not able to get another. These are variables which we don't know about very early. But my feelings are that herd immunity theoretically is not a bad idea. Clearly, it's much, much better if there is a vaccine. But herd immunity can also be obtained by people getting milder forms of the illness. Okay, so theoretically, it might be something that we have to consider when we go back to work, I say the end of May, herd immunity, allowing the younger and fitter population to get the disease, may well be a feasible way of managing the problem, and whilst allowing the Britain's economy to continue.
Okay. Now, I know that there's several labs currently working on a vaccine, and they're saying that to create one, it can take anywhere between 12 months and 18 months. Do you think that timeline will eventually shrink?
Well, as far as I understand it, there are more than 100 companies worldwide that are looking to create a vaccine. In the UK, and I believe also in the US, they already began to trial vaccines, which is astonishing speed when you given the fact that many vaccines can take over a decade to develop. Luckily, we live in times, yes, there may be huge populations, we have tremendous ease of travel. We also live in a time where technology and communication of ideas is also rapid and advanced. So that's more power to us. And there is a hope in this country that there may be some form of vaccine available by September of this year. If that is the case, that would mark a remarkable achievement by humans to be able to achieve that kind of advancement in such short amount of time. And I know that a lot of money now is being invested in aggressively pursuing a vaccine. There's no doubt in my mind that this is the only way out of this particular problem.
Okay. Now, just for people who don't know, could you please explain how vaccines work and how the industry could possibly expedite the process to create vaccines for COVID-19?
Well, expediting it's very difficult. The only way you can expedite it is to have plenty of money for research, to have all the excellent minds working on it and collaboration of ideas, and to be able to test quickly, but also we need to ensure we test ethically. You know, we can't put people under risk, and we need to ensure the vaccine is safe for all and safe for all long term. So that's one thing. A vaccine is a way of introducing an antigen being a pathological bacteria or toxin, into the body in a harmless way to the person, who would allow the immune system within the body to recognize it as an invader and produce antibodies, which are the body's fighting mechanisms against the antigen. This can be done by either taking a particular antigen and bacteria or virus and destroying it, but leaving the outer coating. So when the virus is when the vaccine is injected into the body, it is inactive within the body, but the outer coating the body will recognize as an invader and produce antibodies. And this is then stored in the body's memory, such that the next time the invader is in, which may well be in a proper active infection, the body will realize the signature of the vaccine and say, hang on, I have immunity against that, and produce antibodies very, very quickly. And that's the way that vaccines work.
Now, does the UK have a dearth of HCQ, hydroxychloroquine, for those who don't know, similar to the US? And I know, because I do know the US is trying to garner more supplies from other countries.
Well, hydroxychloroquine is there is some evidence to suggest that hydroxychloroquine may make a difference, but we don't know yet. Trials are still ongoing. It is premature to say that this is the tablets, this is the medication that's going to help deal with COVID. It is part of a cocktail of other medications that are also being trialed, including very promising antiviral therapies as well. So for us to go ahead and stockpile hydroxychloroquine, I believe would be premature. It's promising, and it may work in some cases, but we don't truly know if it is the one drug that's going to save us. So I believe that Mr. Trump was a little bit too early to join on this bandwagon. Although I do understand what he's trying to say in that, well, it may not cause any problems, and what have you got to lose? I do have some sympathy for that. But when you start introducing it widespread to people, a medication that may not truly work, some people will suffer. Mm-hmm. You know, and we have to, because of adverse effects of the medication, it may be small, but it's too much of a number if we're giving it inappropriately.
Okay. Now, do you believe hydroxychloroquine in combination with other drugs will be the treatment that will be used, or is the most promising treatment so far?
As mentioned previously, I don't know. The trials are ongoing. Today I read about a new antiviral therapy called remdesivir, which apparently is very, very promising. We know that in some places common antibiotics are being tried. And why antibiotics, you may ask? Well, some antibiotics like azithromycin and cephalosporins have some antiviral activity, inhibiting viral replication. And so there's a lot of ways of looking at how best to manage this problem. So for us to say that throw all our eggs into the basket of hydroxychloroquine, I don't think it's appropriate at this stage. But it's an interesting way, it's an interesting model of management. And of course, it's a very old drug and a drug of which we have lots of experience. And it's very cheap to produce. Let's hope it does make a difference.
Okay. Well, finally, do you have any parting thoughts that you'd like to mention?
I think the important thing is to note that the vast majority of your viewers will not be greatly affected by COVID. It is a very frightening disease, and people may well be very scared, especially youngsters may be very scared by seeing what's on the news. You must remember that the news only will tend to report the worst case scenario. You don't have a news report talking about good news because no one's going to watch it.
Mm-hmm.
And so, whilst it is important that we observe all the rules regarding healthcare, regarding how best to manage during this pandemic, regarding social distancing, washing of hands, please also remember that, in most cases, people will hardly be affected by this. And this lockdown period, when we are all home with our families, we're very, very unlikely to get this time together with our loved ones again. So maybe it's also a good time to focus on who we love, on who we want to be with, and maybe use this time to make ourselves better in some way. So it's not all bad news.
A blessing in disguise. So, okay, well, thank you so much for being here. I really appreciate it. I'll tell you, I've learned something from this interview, and yeah.
Thank you very much for asking me.
Of course.